Good afternoon, everyone. Thank you for joining us this afternoon. My name is Councillor Anntoinette Bramble. I'm the Deputy Mayor of the London Borough of Hackney. I'm the Cabinet Member for Education, Children's Social Care and Young People. And I really thought it was a good idea for us to have a forum for you as parents and carers to have an opportunity to speak to and hear from some of the brilliant staff that we have here from Hackney. And we've got Gammon, who's the Director of Education and who's been working really, really hard with her team. And also we've got Nicole from Public Health from Hackney that's been working really, really hard as well. And I just felt it was important for us as a local authority to share some information with you about how we've been working with schools and the public health team to make our schools as safe as possible alongside working with school staff. I think it's really important for me to say we won't cover any information from any individual school. So any information that you need from an individual school, you'll still need to go back and contact them individually. But this is to give you a general picture and to pick up any general concerns that you may have. So hopefully that will be helpful for you today. So definitely good to have so many of you join us this afternoon. So you can go to the first slide. Thank you. So I just thought that before I bring in Annie and Nicole, I thought I'd talk to you a bit about what we have been doing as me as a lead member. You can see there Councillor Kennedy, who's the lead member for health, me in the middle, and you can also see the mayor beside me. And that is when we went to visit Stoke Newington School. And they have set up we went to see their lateral flow testing system, which many schools have had. Why we wanted to go and see that is we wanted to understand what the system looked like, how staff were managing that system, but also to have a good idea of when a child walks into the school, what that experience might look and feel like for them. That was very important for me as the lead member for children to understand what that experience had looked like. And, you know, it was so reassuring to walk around that school to see that they'd thought about everything to make, you know, that experience of having a test as simple and as uncomfortable as they could as possible. I have been working alongside Annie, who you'll hear from, and Nicole in a little while, to ensure that we're doing the best we can to support our schools. The Mayor and I have written to government on several occasions, raising the issues that are important to you as parents and carers, also ensuring that we advocate the voice of the child and the young person in all of this, and also taking care of and raising the concerns of school leaders, the head teachers and the staff. Also, I think it's important to say we also work alongside the unions to help ensure that we're doing everything that we need to do for our staff team. So that's the sort of things that we've been doing away with visits. So it's visits, it's meetings, it's speaking to government on your behalf, whether I'm also the deputy leader of the Local Government Association. If you don't know what that is, it's an organisation that supports over 300 councils across the country. And we speak to government about the things that work well locally and the things that are not, and raise it with them. So whether it's ministers, whether it's through what we're doing locally, we are trying our best to work with the schools to make it safe. The last thing that I would say is that we as a local authority don't get to decide when schools open and when they close. That is set as a national level. If we think that schools, for example, don't have enough time, we will always raise that with ministers on our school behalf. But what we always do at a local level is we work closely with our schools and our public health team to ensure that whatever's in place is the best that we can do to ensure that your children, when they come into any school setting, is as safe as we can make it. So on that note, I'm going to hand over to Annie.
Thank you, Councillor Bramble. And I'm just going to echo something that Councillor Bramble said. We're going to talk about the general picture of schools reopening across the country, but also drawing on what's happening in Hackney. But we won't be talking about individual schools, because the individual schools are all set up differently. They know their staff, they know their children. So the arrangements we talk about will vary slightly from school to school. And if you do have any queries about individuals, it's best to take them up with the school. But I think Councillor Bramble will probably say something about that as we get to the Q&A at the end. Next slide, please. So I just wanted to put this slide in. This is available to everybody on the Hackney Council coronavirus website. And I think it gives us a really encouraging context for the children coming back to school from March the 8th, from next Monday. You can see that really high peak in early January following the late December period, but then a very sharp decline looking at that week, the 16th of February and then the 23rd of February, a real drop and much lower numbers, so below 60 per 100,000 and an R rate of 0.6 to 0.8. So this is an encouraging situation for schools to come back to. And of course, education is the only thing opening up from next Monday. Nothing else is changing. So there is that real prioritisation, rightly, for education. And the next slide. And if you just press enter, Chris. Yeah, so of course it comes, and I put that graph on, and those really high bars were from the last 2 months. And it's been very challenging for everybody. It's the third time children's education has been disrupted. If we think from this time a year ago through to the May half term, some children returning for the second half of the summer term, all of them back and largely with uninterrupted education for the first half of the autumn term, but then those increasing cases, and you'll know your own child, whether they had to come home for any length of time during the second half of the autumn term, and then uncertainty at the beginning of this term, and then us being told on the 4th of January that schools would not be reopening apart from children of critical workers and those children who are vulnerable. So it's difficult third time around, and it's winter, so it's much harder to be outside. I think the thing that probably has been better over the last 2 months is that schools have had much more practice and expertise and time to prepare for remote learning. So we know from what we hear from families and from schools that remote learning offer has been stronger than it was first time round, and and rightly so. We learn as we go along, and there's been lots that has developed really quickly over this period. If you could press enter, Chris. And as I say, the Hackney position is strong, I think, for us to return to school. But with that point about the cases much lower and dropping, but also vaccinations being rolled out across the borough, so that so many of our more vulnerable, older residents are safe now, having had the first vaccination. So we are moving into a much safer position. If you could press enter. And I just want to say that the schools and school staff are really looking forward to welcoming pupils back. I was talking to a head teacher today, and he said he cannot wait to have the children back in school. It's what why school staff go into what they do. They are really looking forward to welcoming pupils back to a COVID-safe environment. And if you press enter, and I said it was the third kind of challenge for pupils being at home, but that also means it's the third time for schools to be running through a return to school, that briefing of children coming back, the communications with families. So I think they have also learnt from the times before about bringing children back to school. And enter, thank you. So what's happened and what we've been advising the schools about, as Councillor Bramble has said, working very closely with public health, Nicole and I see a lot of each other, and our health and safety colleagues, is to put risk assessments in place for schools. These are completed by the schools, but they use a format we set out, and they go through all the things that might be a risk and outline what are the mitigating factors. And indeed, there are local operational issues. Schools are laid out differently. They have different numbers of staff. So looking ahead to next week, in most cases, there is some sort of staggering of the return. Thank you, Chris. So I just want to run through the safety factors in place. These were all in place before, and you will recognise them, having space where possible from each other, face coverings where possible, and I'll come on to that, hand sanitising and washing frequently, and good ventilation, which has become more emphasised. You'll probably be aware over the last few months. So I think your children will be expecting to sit in classrooms with the windows open. Thank you, Chris. Testing is new. I think last term, the testing that was in place, you had to go to a specialist site and you didn't get the result for 24 hours or 48 hours, whereas now the rapid flow tests are in place for all staff across schools and settings, with a twice a week test, and they are being implemented for secondary school children, with 3 tests taking place on the school site, and you saw the photos Councillor Bramble showed you. So they have a test 3 to 5 days apart. 1 or 2 secondary schools have had children in already to do the first of those tests. So that will really pick up those asymptomatic cases that were the cause of some of the cases in schools that did happen, the numbers that did happen towards the end of last term. Thanks, Chris. There will still be in place the bubbles, so children as much as possible will not be mixing with other pupils across the school. They'll just be with their year group, in primary schools just with their class, so that should there be a case, the number of people who might have been in contact with the child who's tested positive is really minimised. And of course, for all of us, whatever age we are, if we have come into contact, we do need to isolate for the right number of days. Thanks, Chris. Another change is face coverings, and I think the use of face coverings we've seen through the pandemic has changed, with them becoming much more in use across the country last summer. When schools went back, it was recommended that staff wear them in communal places, but not necessarily in classrooms. And then it moved to students wearing them in all communal places, this is secondary school pupils, but not in classrooms. And as we come back at this point, it is strongly recommended that secondary school children wear them where social distancing cannot take place, including in classrooms. So the children have been bringing, secondary school children have been bringing face coverings in all the time, not all the time, but recently they're used to doing that, but they will be asked to wear them in class. Thank you, Chris. And just coming on to vaccinations, some of you on the call may have had a vaccination already. I'm looking forward to getting my call, I hope quite soon. So vaccinations are being rolled out. Children will be taught about vaccinations. In fact, Hackney's been one of the boroughs that's contributed to teaching materials about vaccinations. But of course, that does make our more vulnerable residents and indeed members of staff much safer. Thanks, Chris. So just coming back to the curriculum and really the importance of children coming back, education is not optional. We want all our children in Hackney to receive a high quality education that promotes their development and equips them with the knowledge and cultural capital they need to succeed in life. And everybody has been doing the best they can with remote learning, but they do so much better in school. The curriculum will remain broad and ambitious. Pupils need to be taught a wide range of subjects, so it won't just focus on the basics, it will be back to the full curriculum. And I think importantly, a real focus on physical, mental and emotional health. I've got down at the bottom of that slide summer assessments, because some of you on the call may have children in GCSE year groups or year 12 or year 13, where they would have been expecting until January the 4th to take some exams this summer, external exams. That has changed now, and schools will be expected to carry out teacher and centre-based assessments and grade children accordingly. They will be given materials that they can use, but what will happen is if a child hasn't covered, if pupils haven't covered the full curriculum, they will be tested on the part they have covered. So perhaps if I can give an example, if for instance, in a normal year, a pupil might be tested on 3 texts, novels or poetry for English literature, but during this period they have only managed to cover 1, They would just be tested on material to do with that one text, or that one book, and they could show on that one book what grade they had reached. They might be at that top grade, grade 9, they might be at grade 7, grade 5, grade 3, but they would just be assessed on the content that they have covered. And there will be some external moderation of schools. The detail of that isn't out yet. Thanks, Chris. This was some research done about parents' responses to the question, what have been the main challenges for your child when learning remotely from home? I'm just going to talk about the top 3. Interestingly, it wasn't so much about the digital divide. We hope your child has been able to access and has had support with devices. But the things that parents said was the difficulty their child had on studying was a top level, lack of contact with classmates, motivation, and lack of contact with teachers. They were the real priorities for parents. So I know Councillor Bramble has said this a number of times, it's really important to get the children back into school safely. Thanks, Chris. I won't spend too much time on this, but just to say things that help children at this time. When you said they've had a tough time, are things like unconditional love, having a close friend, helping others in the community, being involved in interest groups. So these are important things for them that can help them through this difficult time. And then things that we provide through school: access to an available trusted adult, access to appropriate education, clean and safe living environment, and engaging in hobbies. And I think you'll probably recognise some of those as things that help your child through this period. Thanks, Chris. And then these things schools will be aiming to do: promoting a sense of safety through routines and regular information sharing, promoting calming, promoting a sense of self and collective efficacy. So really thinking that children can take control. They can take control of them not being in a vulnerable situation in terms of being vulnerable to being infected. Promoting connectedness, and that getting back into school, being back in touch with staff and with other pupils. And promoting hope. I think sometimes there's a bit of a doom-laden rhetoric, but I think modelling optimism. We know that the great majority of children were really resilient about coming back into schools last September. Everybody needed some chance to talk about what had happened, and some children undoubtedly need more focused, skilled attention. But I think modelling optimism is really important. And then, thanks, Chris. So what we are aiming to do, as you will have picked up from what I've said, is engage all children and families with returning to school, getting the highest possible attendance. It is expected that every child attends, but making people feel safe about that with much communication and reassurance in advance, and making sure children in all cohorts are welcomed and expected back. I hope that this is part of that reassurance. Routines are different, so ensuring the routines, including those around safety, are clear and reinforced, but we know that there do need to be some reasonable adjustments for some individuals. Reconnecting to the full curriculum suitably swiftly, and teachers will be really working hard to skillfully assess where children are up to and work out what are the gaps and how will that be adjusted for the future. Thank you, Chris.
Annie, you've got about 2 more minutes left.
And I think, as I said, providing particular times for reflection and support about the last few months, and really promoting well-being, positive mental health and physical health strategies in liaison with partners. One of the things I know, I've just been drafting a letter about children coming back, and I haven't said very much in this bit, is about their journey to school. We know that children have had varying amounts of exercise over the past 2 or 3 months. And getting back into regular exercise is really important. So that journey to school, hopefully walking or cycling, is important. But we know that there are, people do need to take note of any safety measures if they're coming by public transport. But I think the chance for all of us to be able to be out and about more is welcome, and children should make the most of their journey into school and back to get some exercise. But I would just note that they need to note as well that we are still in lockdown. Education is the only thing coming back. So all the rules about social gatherings still apply outside of school. That's it from me for the moment. Happy to answer questions later, but I know we're going to hear from Nicole next.
Thank you, Annie. And just to reiterate, one of the things that Annie spoke about there is that schools having a staggered return, and we have recommended that schools do take a staggered return back. So please feel reassured about that. One of the other key things that I wanted to pick up that Annie said was health and well-being. So there are 6 principles that we have as our sort of ethos in children, more children going back to school. And one of those key principles is around health and well-being, and that being at the heart of all we're doing for children and young people. And schools obviously have signed up to that and very much have that in mind, to reassure you. The last thing that I wanted to pick up on what Annie said, because there was lots of important things in there as well, is that Annie mentioned laptops. And one of the things that I did as the lead member working with officers is that the government assigned a certain amount of laptops, devices to Hackney, but it wasn't enough. So what I decided to do was locally launch an appeal, and officers worked really hard with me to make that happen. As a result, we've raised over £7,000 and we have 265 devices, and some of them have been delivered. I've had the pleasure of delivering some to schools, and want to thank the officers for that. Thank you if you are one of the parents and carers that have made a donation, and we're trying to get those devices out to schools as and when they need some, and we've got lots of positive feedback from schools that have had them, haven't we, Annie, of how useful those devices are as well. So on that note, I'm going to pause there and ask Nicole to give her presentation. Thank you, Nicole.
Okay, thank you very much for inviting me to talk. I'm Nicole Klynman. I'm a consultant in public health. I work across Hackney and the city, and have been leading the coronavirus response for public health for the last year. Next slide, please. So this is an example of the information that we produce and share regularly with head teachers and with unions, just around the data and the health intelligence. We obviously work very closely with Public Health England and with other London boroughs. We collect data from a range of sources. That data is not personalised. It is by school, it's by setting. We can also divide the data by ward. So we monitor the numbers, we look at outbreaks, we get reports of outbreaks. Life is very quiet at the moment, as you can see. We're busy doing lots of other things, but we're not having to deal with outbreaks in schools. And so that's just an example for you to see. Next slide, please. And again, this is the type of information that we see. We divide the school settings by type: nursery, primary, special school, secondary, and others might include universities or other educational settings. And we're able to see, and this graphically shows how things have been going over the last few months, and numbers at the moment are very low. Next slide. So this is just a reminder of the guidance and protective measures for schools. I think there's a lot of emphasis at the moment around vaccination and around testing, but I think we must remember the protective important things for schools. So making sure that if you or your children are unwell, that they do stay at home, they don't attend school, and they get a symptomatic test as soon as possible. And then if you're obviously have to isolate, that you do for the required 10-day periods. Face coverings, hand washing, isolation, and obviously regular cleaning, the catch it, bin it, kill it approach, minimizing contact with others as per national guidance, using PPE, personal protective equipment when necessary, and obviously keeping those spaces ventilated, which is going to be happening in schools. If you are part of the test and trace, if you've been identified as either positive or someone in the family, or you have been in a contact, that you do maintain the rules and you isolate for the required 10-day period. So all of those things helps us manage this outbreak, in addition to the testing and the vaccination. So I just thought that was quite important to emphasize, and I do appreciate the difficulty of keeping children in, keeping them away from their friends. And I know the challenges over the next few weeks when they say, but I've been meeting my friends in school, why can't I see them? And, you know, I've already got mine asking for sleepovers. So, you know, I can't imagine, I'm sure everyone else is having the same issues. It is going to be incredibly difficult. Next slide. So just to be aware of what's actually happening. So testing for primary pupils is not currently part of the government plan. There is testing for staff in primary schools. What we have done, however, is we've done a Director of Public Health pilot, which means we have quite a lot of lateral flow tests, and we've offered them to primary schools if they would like to run their own testing site for staff and for the pupils that are currently in school. So we're doing that in 7 primary schools and in 1 children's centre. The tests are exactly the same as being done in our own Hackney Council run testing centres. But they've been a little bit easier for staff. Some primary schools were just quite keen to see how that worked. Obviously, if that test is positive, then the staff or the children would need to self-isolate. Next slide. Secondary schools and colleges, bit of a change this week. So as you may know, pupils will be tested 3 times at school. They will get used to lateral flow. They'll learn how to do it. And then they will be provided with home test kits, which they will continue to do. Staff will have home test kits. The schools, all secondary schools, have now established lateral flow testing on site. So that will be available if children are finding it difficult to do it at home. The tests are strongly encouraged. They're part of our response, but they are not mandatory. A positive test obviously means self-isolation, and if the test was done at home, confirmatory PCR is needed, which can be booked online on our council website. If the lateral flow was done in schools, then that confirmation isn't needed. That guidance, by the way, does keep changing, so we just need to make note, and we'll obviously inform schools if there's any difference around that. Next slide, please. This is just a little bit of a summary of where we are with lateral flow testing, that the majority of the testing going forward will be at home. Tests will also be available for families if they wish to test twice a week, and we're just currently trying to decide where those collection points will be. It will be too much for schools to have those test kits. It may be that we have them stored at our lateral flow testing centres, but again, that's just being worked out this week, and we're just trying to understand where would be best. If some schools are very keen to take them and provide them to families, then I'm sure we can arrange that, but that's just a conversation that we need to have. Next slide, please. So just a little bit around vaccination, and to encourage you all to have and take up vaccination when it becomes available. There is a strict age criteria for vaccination, and we're currently working through that. We're now at 60 plus. There's going to be a bit of an issue over the next week to 10 days because there's some supply issues, but by the 14th of March, we're expecting a good flow of vaccines, and we should start to move very quickly through the age groups. There's been a lot of debate around which staff, which occupational groups should and could access the vaccine. And I know this is incredibly controversial. It's not a local decision, it's a national decision. Staff in our special schools have been able to access the vaccine, but I'm aware that the majority of teachers have not been able to. But I'm very hopeful, but towards the end of March and moving into April, we should be moving down the age categories very fast. And I'm really hoping that we can move on and vaccinate everybody soon. Next slide. Schools obviously reopening on the 8th of March. Just a reminder of the protective measures that are going to be in place in schools, and just to remind your children what is necessary, that not to sort of give up on the social distancing, the hand washing, all of those things are part of the response. Thank you.
So most of you, thank you, Chris, for doing the slides. You can stop sharing when you're ready. Thank you, Chris. So I just want to thank both Annie and Nicole for their presentation, and thank you all the team that are working in the scenes behind helping us with this. Before I go to the Q&A, so if you haven't done already, there is a Q&A function on Zoom. Please put your questions in there. We don't have a system where I'm able to promote you up to ask your question, but I will ask the question to Annie and Nicole and any that I can answer myself. Before I start answering the questions, what I wanted to say, which I didn't say in the very beginning, is a thank you to you as parents and carers. You have done a tremendous job keeping your children at home. I don't even understand what the word means, homeschooling, when some of you have been trying to work from home as well. So that learning from home experience, I know, has been a lot to endure, but so many of you have done such fantastic jobs. So I just want to say well done and thank you, and keep going. And, you know, children are nearly back at school. Don't give yourself a hard time if you don't feel you've done everything that you wanted to do. The most important thing is that while your child was at home, that they were happy and you were helping them do as best as you can in whatever circumstances that you're in. So just a big thank you from myself, the Mayor, the education and the public health team. We really appreciate you in all what you're doing. And yeah, we want to say personally thank you, because we feel sometimes you and children are the voices that have been left out of this conversation. So I'm going to go to our questions now, and thank you for those that have put questions in the chat already. That's been really helpful. The first question, now I don't have the names, but you'll recognise your question, hopefully. The first question is, are masks mandatory for pupils and parents? And what I know is that the guidance does say it's recommended, but I'm going to go to Nicole first and then Annie to expand on that. So are masks mandatory for parents and for children? Nicole?
Masks aren't mandatory in law, so they are not enforceable, but they are very strongly recommended. I think it's something that a head teacher would need to take extremely seriously if there was refusal to wear a mask. There are potentially some health reasons why somebody couldn't wear a mask, but I would suspect they are incredibly few. So I would really like to see mask wearing in all schools, in the classrooms and in the corridors. I'm really hoping that it is only going to be a very short period as the numbers continue to go down and the impact of vaccination starts to take hold. I would say that all staff working in the NHS are wearing masks. Staff working in shops are wearing masks. So it's become quite normalised, and I think most children would expect it. So I would hope that we could continue with that.
Annie, did you want to comment?
Yes, I'm just endorsing what Nicole says. It isn't mandatory in law, but it is strongly advised for all staff in communal areas and then secondary age children in classrooms and in communal areas. They don't have to wear masks at break time or lunchtime outside. But as Nicole says, it is for the good of everybody, and we're all in this together. And I think children know almost more than anyone what it's like in school if most of them are doing the right thing and somebody isn't. So I think the more you can encourage your child to expect to wear a mask in school for the good of themselves and everybody else, the better. And as Nicole says, we do expect it to be reviewed over time, and that it's not going to be forever and ever in school that they will have to wear masks. And just that if there is any medical exception, then you should give that medical evidence to the school. Thank you.
Thank you, Annie. I was going to pick up on that point. So remember, some young people will be exempt for medical reasons. So no, it isn't compulsory, but it is recommended that children wear masks. We'll pick up about parents in the next question. So the next question is, can parents be barred or excluded from activities or entering school premises for not wearing masks if they are exempt or disabled? So, Nicole, would you like me to repeat that question?
Yes, I mean, I think that's going to be very much at the head teacher's discretion. I mean, our public health advice is for the safety of everybody in the school, and that mask wearing is mandatory. I think there needs to be then just a conversation. If the parent cannot wear a mask, should they be doing lateral flow testing before they enter the school to know that they are not asymptomatically carrying the virus? That is certainly the expectation for people visiting care settings, and that might be something that head teachers would like to ensure happens and gets enforced. Because I don't know how somebody not wearing a mask can be totally clear that they are not carrying the virus. So that would be a suggestion. Again, it's not mandatory, and it needs to be up to each school to take that forward.
If I could follow up, I know that schools and you yourselves as parents will have made big efforts so that you're not going into school. I mean, arrangements of dropping off children at the school gate have, changed significantly, and timing of children dropping off, so that there are reasons for a parent to be in school are minimised, because schools are absolutely minimising the number of visits by anybody external.
So we've got quite a few questions coming in, so we're going to try and get through as many as possible. We'll try to be as short but as detailed as we can be for the questions. So our third question is, can you confirm that with respect to children and families that there will be no on-site vaccinations or temperature checks required by the local authority? So as a local authority, we are not doing any temperature checks or on-site testing. Testing is run and carried out by individual schools, and obviously the government has asked schools to have lateral flow tests in. As you saw in the beginning of my presentation, I had gone along to visit one of those settings as well, and Nicole was there with me on that visit as well. So I don't know, Nicole, did you want to add anything to that?
No, we certainly wouldn't be advising on temperature checks at all. The reason is you can carry the virus completely asymptomatically and be without a temperature, and that's much more likely in children that they could be just totally well. So it would not help us at all. As for vaccination, the schools will not be a site for vaccination, and it's currently not within the school-based programme. Vaccinations are for 18 plus, though I suspect they'll be going down to 16 plus at some point, but they will be either delivered by GP or within one of our sites.
So Hackney has done some lessons about vaccinations, and that was devised by one of our schools. Annie and the team worked with those schools, and it's something that's been rolled out at a London level. But as Nicole rightly says, at the moment, children are not being vaccinated. So is it compulsory? Annie, this one's for you. Is it compulsory for our children to go back?
Thank you.
Yes. Yeah.
It is.
Yes,
It
yes.
is. It is expected that, as in normal times, every child attends school, and you've heard about all the safety measures in place. So we are expecting every child to come back. Clearly, you know, if a child is ill, then as pre-pandemic times, then they shouldn't be in school, but otherwise they should be in school.
And just to add, if you are isolating or you have underlying health conditions or your child has underlying health condition, speak to your GP, speak to the school nurse. We're not saying that there is advice out there, so do seek it. But generally, the expectation is now that schools are opening to all children again. The expectation is they are back at school. But if you have issues around health issues, please, please, please contact your GP, the school nurse, and talk to your school.
Yeah, thanks, Councillor Bramble. And of course, hopefully that everybody who's clinically vulnerable will have been called for a vaccination. So they're much more protected. And that is that point that actually if someone in your household does have COVID, everybody in the household needs to self-isolate. So then you wouldn't go to school. But otherwise it is expected everybody's at school.
Why do you think children who are anxious have to wear masks in classrooms, and why aren't teachers top of the list from being vaccinated as they work on the front line? Well, in terms of vaccinations, you know, I will not rant to everyone today, but we totally understand teachers, parents, teachers, and the community wanting teachers to be vaccinated. It sounds like a sensible way forward, but that is not how the government are doing it. The government are doing the rollout program of vaccination based on age. That is the strategy that they use. Locally, we don't get to make that decision. If we had that decision-making powers, it would be something that we would consider. Nicole, I don't know if you wanted to add anything more to that.
No, I mean, the government's basing the program based on age because we have a JCVI, a joint vaccination committee. Very senior experts have looked at the risk for teachers compared to the risk with age, and have decided on balance that age is the biggest risk factor for severe COVID. And we're talking severe, we're not just talking COVID, we're talking severe, hospitalised, ITU, and that's why they have decided to go through as quickly as possible through the age categories. In terms of anxiety with mask wearing, I realise that may be an issue for a small number of children, but I think the vast majority of children have now pretty much adapted well and got used to mask wearing, and it's quite normalised now.
And it goes back to what I was saying, talk to your health, speak to the school nurse, speak to the school, speak to your GP if need be. If you know you've got a child that will create anxiety for those barriers. A quick question, can we put the slides up on the website? And I'm sure that won't be an issue, or the appropriate information will be up on the website, but we will be putting some information after this session up for you. Someone who runs an after school club, Pat, has been saying they run an after school club, but is there anything in place for out of school settings to be notified if there are cases in individual schools where children have been told to self-isolate? This is something that they've been asking for since September. I would say on that, contact the individual school, because I would hope there is good communication between any external provider and the school in terms of communication and keeping everything COVID safe and compliant. So Pat, please contact the individual school. Obviously, if you have any continuing issues, please do write into us, but that information should be available from the school. And again, whether they go into how many children, what class, that I don't know, but I'm sure if there are cases that you'll be notified. Let's go on to the next question. What happens if a child does not take the test, Nicole?
If a child refuses to have the test, I honestly, I think it's going to have to be a decision for how the school wants to manage that. I mean, there may be that they've got anxieties doing it at home, and they may feel more comfortable doing it at school, which is why the lateral flow testing centres have been set up at school. It may be that they just need more support. Maybe they can watch a friend doing it. I don't anticipate this being a huge issue, but I think some children may need a bit of support and encouragement for it to happen.
Yeah.
Annie, Annie, you want to come in?
Yes, thanks. I'm just talking to a secondary school head today who said they've got 90% permission slips back from families, so a very high take up. There is a bit of anxiety from a really small number, and we all get anxious about some things, and their school staff are talking through the issues with those families, and often with that individual talking through, families' anxieties have been put to rest and they're happy to go forward with the testing.
So there's a question about booking vaccinations before we turn into work, and there are lots of places where people can just go online and just book a desk before they go back to work. That is right, isn't it, Nicole?
If they want to book, you're talking test or vaccination?
No, this one is test, but also vaccination.
Okay.
Vaccination, test you can book, but vaccination you have to wait until you are called.
The testing is available to book at any of our testing sites, or if you work in another borough and you prefer to get tested there, look at our local authority Hackney Council website. You will have the link, follow that, and it's very easy to book a test.
But with vaccinations, you have to wait until you have been called and by the NHS, or some people have heard out for their GP. Again, the government have a programme where they're rolling it out by age, so you can't get a vaccination before you go back to work, unfortunately. Will the testing for children be given to the child that's from school or sent home to the family? So it's both, really, and this is only in secondary school. They will have, I think, 2 tests within school time, and they'll have 1 that they can take home, so that can help them.
3 within school time, and then they'll be taking home a test to do twice a week at home.
Brilliant. Is there any confirmation on what the proposed plan is for pupils to catch up lost time? The government were talking about summer school or a longer day, and I know this is something that Annie and I have spoken about and deliberated about, because you don't want children to feel they've got to work longer or harder because of what they've missed, and it goes back to that whole well-being piece. What's the balance? Annie, can you come in on this?
Yeah,
question,
I think the most important thing is to get children back having high quality face-to-face lessons, and then you may know that schools always put in place some additional support for children who they want to make a bit more progress, and they will be using some of the same strategies, which may include, occasionally they're before school classes, lunchtime, after school, maybe working in a smaller group, and the government has made money available for that additional support. So some might be in smaller groups or during the school day, some might be outside the school day or holidays. I think schools are really concentrating on getting the children back into lessons, and then I think more information about that catch up where needed will follow.
That's it. And just to say that education, we've committed, I think, just over £300,000 into making sure that children and parents have extra support, something that I've discussed with Annie and her team, and we're thinking about how we use that money to facilitate children back into school and what they need, and working with parents, and you'll hear more about that's going on. It's a political decision that we took because we understood the importance of it's a really, really unusual time, and lots of people and children will need support in different ways. Nicole, there's a parent that wants to know what schools will be taking part in the pilot. I don't know if you have that list to hand, or if not, that's
the primary school pilot.
Yes.
I have that on a slide, or do you want me to circulate it afterwards?
So let's circulate that after, so we can get through some of we've got about 6-7 questions, so let's try and get through as many as we can. How will you ensure proper ventilation, given research shows how much the virus transmits through the air? So basically, what does ventilation look like in schools? What I can say with our newer buildings is that they have really, really good ventilation systems in place already built in terms of the design. I imagine schools will do things like ensure that windows are open at set times, not to the extent that children are cold at the time. So heaters on, but windows open, doors open, all those kind of things that they can do. Also, there's a robust cleaning regime within our schools as well, to reassure you. Annie, I don't know if you wanted to add anything more onto that.
Only that I know, we're getting into warmer weather, so hopefully it will be less difficult to have windows and doors open wherever possible. But I know that schools will give advice if they want your child to wear an extra layer to stay warm if the windows are open.
So we've got a question about why you're not testing junior school children, simply because it's where the government initiative is. So there are things that happen nationally and that we wait and respond, and there's things that we can do locally, and that kind of decision as to the age of the children and when they're vaccinated is on the government, but also it will link into research and how young you should start vaccinating children.
The other issue is about doing the tests. So secondary school children do their own tests. Primary school children would have to have the test done for them. There is then issues about who is suitably qualified to do the primary school test, and then what happens if there's a problem and if the test is not done correctly. So obviously with secondary schools, they're given a mirror, they could do their own tests, and it's relatively straightforward. It is primarily from the throat, but if you can't do it from the throat, then it can be a nasal swab, which again is very easy.
So how is the home rapid test kit made available? My understanding is that children and families will be able to collect them from schools, as far as I know.
Children will collect their kits from schools. We're just trying to work out how families will collect their kits. And I'm sorry, I have not finalised whether those kits will be delivered to schools or not. It really is going to have to depend on our ability to deliver to all schools and our ability to for schools to store those kits. So this all came out this week. We've just not finalised it yet, so please bear with us on that. But children will definitely get their kits from schools.
So as I said, children can collect theirs. Parents, we're still waiting, as Nicole said, when we find out. Can children be turned away from school if they're not wearing masks in classes?
I think we probably tackled that. I think that was the first question. So it's it's highly recommended. Schools will be expecting children to wear masks, and as we heard from Nicole, there's a whole range of people across the country in different workplaces who wear masks all day. So we know it can be done. Sure, it's not as comfortable, and perhaps children aren't used to it, but it is really important that they wear masks.
Okay, what sort of, it's important that they do, but as we have said, it isn't mandatory, but we strongly are advising that. What sort of help is available for secondary school children in year 11 with complex care needs going into normal state schools? So I imagine the provision, if they have a statement or they have a plan in place, that plan will be revised to support their needs and take into consideration the impact of COVID and the setting that they're going into. Annie, I don't know if you want to add anything more on that.
That's absolutely right. I think I said somewhere there needed to be reasonable adjustments for particular needs, and certainly we would advise you talk to the SENCO if they have not been in touch with you, or if you feel there will need to be some adjustments.
Nicole, do you know the length of time that the results come back from home test? It says, does the home test give an immediate response?
Immediate response, they're lateral flow tests which give you immediate response. So the instructions will be in the kit, but by the time those kits go home, the children should be very well versed with how they work. They've done it 3 times, they should be able to do it at home.
It says, will lateral, I think this might have been answered already, will lateral flow tests be provided for parents to test their children at home instead of at primary school? But that isn't, but they're not testing primary school children at the moment, so that won't have that.
But can I just say, government guidance changes rather frequently. So today they're not testing primary schools. I don't know what will happen next week.
So yes, thank you. Well said, Nicole. So today, as far as we know, the guidelines is we are not testing secondary school children. There's another question about special needs. If they have special needs, are they expected to wear masks? I think it goes back to what Annie and I were saying about reasonable adjustment. It's about the individual child. There are some children with special educational needs that will be quite confident and happy to wear a mask. There are some that will not. So I would say that's based on the need of the child rather than making a blanket statement. Trying to get through some more. I read from the government that primary child care are tested at school. Is that the case? No, so no primary school children are being tested at the moment. This is from secondary schools.
Unless they're in our pilot of the 7 schools where currently some key workers' children are being tested. We haven't decided what happens going forward with that, because obviously it's very different when there are a lot of children in the school. I suspect it's not something we can continue going forward.
So will children potentially be put in a situation where they need to resit this year? So Annie and I and the team have been working really closely. One of the things that government has done is they did a consultation around the exams and the exam regimes, and we submitted to that as a local authority, saying to government what any exams, if any, should be looking like. So the government have now said that young people won't be sitting exams, and any test that's done will be set out by the school if the school uses that. So I don't think I wouldn't necessarily think children are retaking exams or resitting exams this year, but I don't know if you're talking about GCSEs, that might be something different, Annie. So if you want to come in and talk about that.
I guess in normal years, some children do resit. They sometimes resit their GCSEs. In fact, they have to if they get a level 1, 2, or 3 to try to get to a level 4. And some children resit their A levels or equivalent exams because they want to get a higher grade than they did first time to get onto a particular apprenticeship, university, where there's a boundary of what grade you need. So some pupils may want to resit for those reasons, but they shouldn't have to resit because they've missed some school, because the grade will be based on the content they've covered. So they may choose to, but they shouldn't have to.
Will any schools be providing masks? Not as far as I know. I know, like with all schools, there's always schools that provide spare school uniform. I'm sure some schools will have more spare masks on site, but that's not something that I think every school is providing all children for. But we can definitely feed back to school that parents have raised that.
Yes, and I think we've advised that they might have a small set of masks available if someone's lost one on the way to school, but I think schools will give out guidance about what they expect from pupils. And if I can just come in, because I can see Yvonne, one of the participants, said she was asking about primary school retaking tests. No, I think there'll be assessments during the year, as there always are, so children will do those, but there's no sense that children will resit a year, stay in year 4 for another year. Children will be expected to go up through the cohorts.
Thank you. So in your graph, it showed that most cases were in primary schools, but the children aren't going to be tested. The ones that pass it around most, she said that makes no sense. So what the parent was saying is that cases seem to be higher in primary school, but we're not testing in primary school. How do we manage that?
These numbers were very low, and they've really fluctuated from week to week. The cases were very high in secondary schools as well. It is simply government guidance that we test for a secondary school because of the reasons I've said with issues around testing in primary school. But who knows, that could change next week. We don't.
Yeah, And if I can come in, we do have more children in primary school altogether, because there are 7 cohorts in primary school and some nursery classes. So just the law of numbers would say that's likely to happen. And of course, those peaks absolutely reflected the prevalence in all ages. And if we looked at that graph, the cases are very low now and coming down. So it is not completely 100% no cases anywhere, but just much, much lower. So making it much, much safer for children to go back to school.
There's a question about what happens if parents don't give consent. I imagine that what schools will do is just follow up and maybe have a conversation with those parents. And what we are hearing back when Annie and I have discussed this is that the majority of schools are getting a good return back from parents giving consent overall. So
I think there is also the question of older children, whether they will be able to consent themselves as well.
Okay, so I've just had a quick question. Someone saying if a mask breaks in school, will they be sent home? So I think, again, that's something that you'll contact your local school about and have a conversation with them. As Annie said, we recommend that schools have some spare masks. And I imagine that most schools, if not all schools, will have a few masks spare because of that, just in the same way they have spare school uniform or spare PE kits because children sometimes forget them or things get lost. I think that will happen the same way in masks. So I want to thank you all. I want to thank Annie and the team and Nicole and the team, and thank you in advance for all the work that you're going to continue to do alongside myself and the school system. I want to thank you for parents for taking not just the time to join us, but also just for being bold and brave and honest and raising your concerns with us about what you are feeling. We really appreciate that. What we'll do after this session is put the information up on our website. There'll be some information from me thanking Annie and the team again for all the hard work that they are doing, and Nicole, and the Q&As that have come up. We'll make sure those responses are up on the website. Just do give us just a little bit of time to be able to do that, but we'll do that as quick as possible. The last thing, you're welcome. People are saying thank you. One thing that I want to say as well is that I've asked officers and they've kindly agreed to help me to do that. We're having one of these sessions as well on Thursday for young people, because I want to give young people the opportunity to raise their concerns about returning to school. As Annie said, head teachers, staff are just really excited and waiting for children to come back, and children are really, really excited to be back. But what we want to do as your local authority is just to help alleviate some of the concerns and pick up the questions that you might have. But government has said children have to go back, so we just want to work with schools and support you in getting children back as quickly, as safely as possible, and answer any queries that you have as we go along. Thank you so much. I wish all of your lovely children a safe and happy return back to school. Take care, and thank you so much for your time. Thank you, Annie and Nicole, and everyone in the team at the back that made this possible. Thank you so much. Take care and stay safe, and follow the guidelines and encourage your children to do so as well. Thank you so much.